You're welcome back to Sunday Breakfast right here on Channel One TV with me, Inosafo, and Jude Duncan. We're about to delve into a conversation which some may say is controversial, but controversial or not, we're still going to have the conversation. So you can send your questions to the WhatsApp number 0204-447-033. We have Dr. Annie Gazy, a clinical hypnotherapist and addictive behavior specialist with a psychology background. And today we're talking alcohol abuse, reducing harm, and self-help tips. Alcohol abuse, reducing harm, and self-help tips. Dr. Annie, how are you doing?
I'm very well. You know, when I'm here, I'm happy, especially with my two favorite people. So good morning to you, Eno, and good morning to you, Jude.
And I'm always also happy having you.
Oh, thank you. It makes me feel good. Feels like my second home. I keep saying that, right? So it sounds like I'm pretending, but I'm not.
Dr. Annie, why is it important to talk about alcohol abuse?
Before I talk about that, please forgive me. I need 2 minutes. You can see I've got a paper in my hand.
Yes.
Because I just want to commend Channel One TV for the magnificent job that you've all done. Regarding a little girl called Jalila, 8-year-old girl called Jalila from St. Olive's Grammar School. And I just want to commend the reporter, the journalist who covered the story. That's Fauza Masawudu. Thank you. Now, the reason why I'm saying this is I didn't even hear about the story, but somebody tagged me on my social handle, Facebook. So my colleagues in UK picked that up and asked me whether I was involved. And they actually send me messages like WhatsApp, asking me what I'm doing about this and if there's anything they can do to help. And I felt a bit silly, but the good news is the story has gone global because people are picking it and they're discussing it in meetings. So like the clinical aspect of it, the trauma involved with the parent, the child, and the other children in the school. Now, having said that, I also want to commend the Minister for Gender, Dr. Mrs. Latte, right?
Momo Latte.
Momo Latte, thank you. And that's why I wrote it down because I didn't want to forget. And then the Greater Accra Regional Minister, Honorable Linda Ohenewa Oklu. Yeah, I just want to thank them all.
Ohenewa in her name?
I think I saw Obiniwa. Oh, sorry, please forgive me if you're listening.
I think her name is Linda Oklu, right?
Linda Oklu, so Honorable Linda Oklu. Let's leave it there. I just want to say that the way it was handled was brilliant, and I strongly believe that Channel One will keep up with the story and follow up. And anytime, I think I would like to go up and visit the little girl as well, so that whatever support that we can all give in terms of the trauma aspect of, and then I would also like my hat goes out to her and the bravery of telling the story for that age and what she went through. The fact that she was able to tell her story is so beautiful. So I commend her for that. So thank you all.
Doc, you're actually right. So it's Linda Akwili Obenewa Oklu.
Okay.
You know, Oklu is sounds very Gan, or Akwili also very Gan. So I wasn't really sure the Obenewa. But according to Parliament, that's her name.
That's her name.
So you did your research.
Well done. Thank you all.
Well done. Thank you
very much.
Fauzi Masaudu, you know, he's been on this show a couple of times.
Has he? Okay.
Has, you know, significant interest in social issues like this.
Right.
You know,
okay. As you both know, I'm very passionate about issues like that.
And all of that.
And just to let you know, and anybody listening, my colleagues are prepared to also help in any way if we need them.
What are you doing about it now that you've got to know about it?
Obviously, I have to partner with Channel One and see what's going on, and then I'll be part of, visit, and also I'm happy to work with the family in terms of the trauma and any other thing that I can offer. I'm sure that lots of people are already doing stuff, and for the fact that the government and everyone is involved. But the reason why I'm happy is that sometimes we get media covering stories and that's it, just covering. But the fact that they're involved a bit more and how it was covered, so it really captures the trauma. And the fact that we have these stories and sometimes we don't capture them. And by capturing it so well, it's attracted the attention of the, you know, the upper side of the government to actually say we need to do something, and they are doing something. So for me, I'd like to be part of Channel One to see what is being done or what needs to be done, and then my input. I would like that very much.
That's amazing. Great. We'll definitely take this up after the show.
Yeah.
Right.
Thank you. Sorry, now ask me.
Yes, now I can ask you. I was asking why it's important to talk about alcohol abuse.
It is important because alcohol is a legal drug. Sometimes people don't like the word drug when we use drug, but it is a legal drug. It is a substance. Anything that affects our CNS, that's the central nervous system, or affects our brain, it's a drug, and it is addictive as well, and we're all aware. But because you can just get up and go to the shop and buy alcohol without any stigma, without anybody attacking you, compared to maybe other drugs, it's okay. You know, as long as you're of a certain age, you're an adult age, and then you buy it, you're okay. And if people see you drinking in public, in a pub or a party or socializing, whatever, it's acceptable.
Right.
And I think society's come to accept that, we celebrate with alcohol. We mourn with alcohol. What else? Everything, every human society, whatever activities involves alcohol.
In fact, the president of this land told us that when Ghanaians are happy, we drink.
It's true.
When we are sad, we drink.
That's exactly what I said.
Whether we are happy or sad,
exactly.
we still drink.
You know, and even if we look at, like, we watch movies and all of that, we see our role models or the affluent people, their champagne and everything. So it's like, it's acceptable.
Yeah.
And sometimes even it tells people, or the younger ones, that if you don't drink, that means there's something wrong with you. You know, personally, sometimes people wonder why I do this job, in the sense that I don't even drink. And it's not for a religious reason or anything. It just doesn't
appeal to you.
Exactly. I can have it, not because of whatever, but I just think whatever. But people say, so how do you do it? And I said, you can be happy without alcohol, because sometimes I remember years ago, like when you go to meetings or you go to your social stuff weekends, I said, how are you so happy you're not even drinking? I said, I don't need alcohol to be happy. I'm my happy person. So it's about people, and people don't realize the impact.
Right.
That alcohol is actually a drug and is addictive, and is when you have it on a minimal whatever, you get that stimulation, that stimulant. So people think alcohol is a stimulant because, you know, the tipsy version where you're laughing, you're giggling, and you feel like you're confident and you can conquer the world, that stage. So that gives you that stimulation. So sometimes when you ask somebody what is an alcohol, they say, oh, alcohol is a stimulant. It isn't. It's a depressant, because it depresses the central nervous system. It depresses something in the brain chemicals that make us happy. We call something serotonin, which is the happy brain normally. And the happy brain, what it does is, that's what affects our emotions and that. Then we've got dopamine that deals with the reward system. So for people who drink a lot, alcohol is a reward to them. So they don't realize that actually they're abusing alcohol. They don't see that, they see the reward, because like I said, I'm able to laugh, I'm able to sleep, I'm able to, but what they don't realize is, it's okay to drink, but after, especially for people who drink in the evening, by the time you go to bed, about 2-3 hours, you crash. And you wake up again and you think, oh, why am I not sleeping? But they think that the alcohol was the one that made them sleep. They don't realize that it was alcohol that woke them up early. So when you're doing these things or taking in the alcohol, you're actually going through abuse. Have I answered your question?
Yes.
Yeah. Sometimes I tend to go on a bit. Go on. Sorry.
So when does drinking move from social to abuse?
Dependency.
Yeah.
Right. Great. So sometimes people are young in school, they are going out having, like you say, socializing, or maybe here we can say, oh, after this, can we go have a drink? So we're socializing. But then gradually, if let's say after that, you said, oh God, I'm so stressed from work today. Let me just have a glass of wine, or let me just have a bottle of beer or whatever. Then it turns that, oh, he made me feel good, the reward. So dopamine is talking now, the reward that actually I got something out of it. That's the brain function. So once, so psychologically, mentally, it's making you feel great. Then you have that the next day, well, maybe if I have this again, then I have this again, then I have that again. So, and then we have those who are the binge drinkers, who maybe like, could have had a fantastic week, or I've just won the lottery, or work was good, or promotion, or, you know, I've had a hectic week. So the weekend, they can drink maybe from Friday to Sunday, so that they can drink and drink and drink. So those are the binge drinkers, that's in between. Then we have the problematic drinkers, or what you're saying, the dependency drinkers, people who can't stop. And that is where sometimes, like in families and that, people who can't stop, and somebody will say, oh, you drink too much, just stop drinking. It's easy for you and I to say stop drinking, but that person can go into a seizure and then die, because for them, That's why sometimes you sit with somebody and either they're shaking or you watch them carefully, people who drink a lot, because they need to top up to keep up. So you drink, you give them alcohol just to keep. Somewhere where I used to work, like in the UK, and that sometimes even when somebody is not working or they don't have the finances, we give them a token of something, so at least they can buy alcohol to keep them going. If not, or they get a substitute medication that really keeps them going, because if you don't do that, something might happen to them, or you have to keep them in hospital just to monitor them, you know, for that to happen. If you come to me and you're a problematic drinker and you want treatment, if you just want psychosocial intervention, somebody will say psychosocial, that's the talking bit, looking at your network, looking at your environment, your work and that. But the actual treatment in terms of maybe giving you a substitute medication or asking you to start reducing your drinking and all of that, I will need to make sure that you're in an environment where you're safe. Do you live with your family? If not, are you close to a neighbor? Do you have other people in the house? You know, we look at all of this, else treatment can't start because it's very difficult. And I would advise anyone listening that if you have somebody who drinks a lot, it's important for them to reduce gradually. That's why today we're talking about harm reduction. When we talk about harm reduction, it's about the harm that affects the person and the people around them. So what I'm saying now, it's reducing the harm. Somebody say, why would you ask somebody that they should reduce? Today, as you can see, you also, can we go to school? Are you able to hold whilst you're holding your cup? Okay. So for those watching, I don't know whether you can see. You see that there are numbers on there. Safer way of drinking, forget about the 3 to 4 units a day for men. Now it's recommended that both men and women need 2 to 3 units of alcohol a day. Somebody would ask, what is 2 to 3 units a day? So you see this cup I'm holding, 2 of this is your 2 to 3 for beer, right? 2 of this. So that is the recommended that you're safe. 2 to 3 of this cup a day for beer or cider is safe. Now, if we talk about wine, let me see. Somewhere here, I don't know whether it can be captured, a day, that's your safety. That, yeah, because 2 to 3, that's 2 units. So a little bit of that, you're okay. Go beyond that, then that your health could be at risk. Now, if we talk about spirits, your brandy, your vodka, your whiskey, whatever, can you all see it?
Yeah. Yep.
Can you point it where it is for a unit?
Right at the bottom.
Thank
25
you.
ml.
Exactly. So that 2 of that is all you need a day.
Oh wow.
If you're drinking spirit. So if you come to me, you know, as a specialist, and you're somebody who drinks spirit, in order for you to be safe or healthy in reducing harm, maybe I'll tell you, all you want, for some people, they've drunk so much that they even enjoy holding the bottle or the glass. So I'd say, all right, let's go to wine, because at least you can have that a day. And then you can break it down or dilute it or whatever. Or you can have 2 of this. Beer. So go to beer because the alcohol content is not as strong as pouring a glass full of whiskey or brandy or vodka or whatever it is, you know, like strong liquor. Exactly. Yeah. A day. Yeah. So it's about, so I will work with you on that look at this and then drink this, measure it nicely and then have it. And also, having said a day doesn't mean that every single day you have to drink. You have to drink up to 14 units. It's written there. 14 units of alcohol. Is it there or is my other glass? Forgive me if it's not. But 14 units. So if, let's say, you're having 2.3 a day or 2.5 a day, the whole week you have to only drink 14 units. That is the recommended alcohol you can take. Then you have to give your body at least 2 free days to detox. So if I'm drinking 2.5 on Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday,
no alcohol.
Body detox. You don't drink alcohol. So you need at least 48 hours. I'm looking at Eno's face. I'm thinking, is she looking innocent or feeling guilty? Which do you think?
If I take you to Blue Kiosk, Doc, you might collapse. There's other place at A&C Mall. If I take you there, I'm sure you have. Anyway.
Maybe we have to set up a store there one day.
I'm telling you, wow.
Yeah.
But Doc, my question is,
carry on.
Is this, you know, a lot of research goes into this, and we appreciate the intellectualism and the, you know, all that goes into it. But is it also tailor-made for us, right? Because we know that sometimes, more often than not, a lot of the research done doesn't purposely fit those of us in the global south,
right,
or even in SSA countries.
Yeah.
Right. So my question is, what convinces us that this applies to all of us, taking into consideration weather, our societal systems,
of course,
and every other thing that matter.
Yeah, it actually does work for us. What the differences are: body size, your health, your age, all of that. So let's say for every alcohol that you take, let's say I've taken in 10 units of alcohol today. For me to get rid of that alcohol, for every hour, I lose 1 unit. So sometimes somebody would say, oh, you drink all night, you go home and say, oh, but I slept. I'm okay now. I can go to work. I can function. Why have I got a hangover? Because you haven't slept 10 hours. And even having said that 10 hours, maybe for me, my size, my weight, my health and everything, I might just lose 0.5 an hour. So it's not necessarily for everybody. So we're talking about a healthy, average healthy person, young person like the two of you. You understand? 1 unit. So you can sleep for 5 hours, wake up and expect that everything is all right, but it's not, because your body is still processing that. And I'm going to do a little, and I'll continue answering your question about, because I've worked with people here, and it works for, the only challenge here is some of our alcohol, like, is it apetisi? And then there's the local palm wine or whatever. Sometimes it's difficult to tell how much the alcohol content is because it hasn't been measured. We don't have a research to support or back how much alcohol content. But I think that some of them, apetisi, for instance, are put it under spirit because it's quite strong.
A different grade.
Exactly. So that's the grade. I treat it as a spirit. That's how I would treat it. So with all of that, but I've worked with people in this country, and I've got colleagues, other people, or psychiatrists or whatever that I've worked, and it's similar to be. So I understand what you're saying, and from other countries and all of that as well. We work with black people in other countries as well.
Where you come from, I understand people drink to keep warm, right?
It depends. Not everybody drinks to keep warm. I mean, if somebody's got a problem or whatever, it's just like here. I think that you see, one thing about our country or our continent is we don't talk about it. So maybe my father is drinking heavily or my partner is drinking heavily. We accept it. We don't talk about it. The stigma. So we don't see. And lots of abuse, I don't want to go into that because that's a different subject, but domestic abuse and all that is to do with drinking, because that's some of the effects of people drinking. People drink a lot. If you go out right now, people in bars, pubs, this, that, every corner, and they drink with food. People don't just go out to get their fufu and soup, they actually drink a lot. And if you look at our bottles compared to other countries, our bottles are huge. Sometimes they scare me. Like, I'm not condemning any company on it, but the bottles are quite huge. And people can sit and drink. And somebody can put, can you give me a bottle of vodka or whatever it is? And it's like there's 75 cl, not a little one. Where I come from, somebody can just get that little one and that's like, okay. But here people can afford it, so people can drink, and those who can't afford go for the ones that we haven't measured and we haven't done research to see how much. And maybe that's a project that some of us will have to take on and see whether we can work with the medical board to see whether we can grade that as well. So if that person sits and they're drinking, you don't even know how much they're taking in, and we don't monitor.
That's true.
As long as we're telling the pub lady keep it coming, the tap flowing, we just keep drinking and drinking and drinking without monitoring, and that is the risk. That is risky. Emma's been laughing a lot this morning.
I want to find out, is alcohol dependence more about willpower?
Everything is about willpower. It's about the brain, the power of the mind. So we're talking about it now. Maybe now, I'm sure there's somebody sitting at home or sitting somewhere saying, wow, I didn't realize this. So the awareness. So good. That's a good point. Now, willpower. So we've got in addiction, we have something we call the cycle of change.
Okay.
So it's a bit like this, and then we have about 5 different points, different areas. The first we call pre-contemplation. So that is where somebody listening right now is thinking, I actually don't have a problem. I can drink and drink and drink, and I'm fine.
I can still drive home.
I think that Jude asked me a question this morning. I can find my way home. I can drive home.
Yeah.
Okay, so we've got that. That is pre-contemplation. I don't have a problem. No awareness. Everybody around them is saying, or maybe you have somebody in the office, they come smelling of alcohol, everything. I don't have a problem. As long as I have my alcohol, I can function. So that person is in denial. So we call that pre-contemplation. Then we move to contemplating or contemplation. That is, at this point, if everybody is told them, they've begin to see that it's affecting their work, it's affecting their everyday. Maybe even the doctor said, listen, your liver is going, you know. The test is showing that your liver is going. So such a person, you know, they are contemplating that actually I do have a problem. I think I do. So that is stage 2. So stage 3 is decision. Now, okay, if I have a problem, what is next? What do I do? I'm watching this program on TV now. I see that I actually do have a problem because I'm drinking all the time, or I'm binge drinking. It's affecting me paying my kids' school fees. My health is at risk. I may lose my home. All of these factors. I may lose my car. My friends are leaving me. My family are not happy. So that means that actually there is a problem, and I have to make a decision. And the next is that the action. So that person will come and see somebody like me, or go to their GP to go and say, actually, doctor, you know what? I'm having issues. I think that I'm really struggling. Can you help me? So then the treatment and all that will start.
Right.
Yeah. So that's where the willpower. At that stage of contemplation or making that decision, that person can say, you know what, I'm drinking too much. Now that I've listened to Dr. Gazy, I'm going to cut it down. I'm going to have 1 glass of beer a day or whatever. So that's the willpower of actually, I do have a problem, I do. So do you get what I'm trying to say? So right from that stage, they can say, I'm going to do something about it. Willpower, power of the mind, they can do something about it. Or maybe there is an incident in town about, God forbid, an accident or whatever, and then there was a drink driver. So you decide, oh my goodness, this could have been me. And before we carry on, can I just do a quick experiment? So I'll start with you, Eno. Put this on. This, it's a goggles for a driver who has drunk and think that it's okay for them to go anywhere. And you tell me, look at Jude, look at me, look around and tell me how you feel. So let's assume that you've just had alcohol after a party and you feel so good that you can drive home and be okay. Please put this on. Tell me what you see.
Okay.
I think it's the other way around.
Is the other way around?
Yeah.
Oh, yeah.
That's right.
Okay.
So you tell us when you look around what you can see. Right.
I can't see anything.
Right.
Okay. Well, I mean, yeah.
How does it look? Fuzzy? What? I don't even want to put words in your mouth.
It's a bit fuzzy. Like you can't really see.
How many of my fingers are up?
I have no idea.
Thank you. Right. So pass it on to Jude as well. Jude, have a look. So you've had your very good drink, a good party, and think that's fine. Let me
I can drive home.
I can drive home safely, you know, because I'm a good drinker. What do you see?
Clearly.
Can you be honest with us, please?
How many fingers do I have up?
Your 2 index fingers are up.
Oh, wow. Okay. Yeah, but you navigate your way a bit, right? Okay. So basically, all you're trying to say...
You still to be fair, it's blurry, right?
Yeah, it is
and
blurry.
if that's how people see it, it's dangerous.
And I have different versions of it. If you've had 2 bottles, if you had 3, we don't have time for that. We need a whole week to actually, that's your alcohol treatment. So if you come to my service, these are some of the things that we go
see
through.
like this when they are drunk,
yes,
driving?
That's how, That's
so this is when you're completely drunk?
No, not completely. If I bring you the completely, you won't say anything, because normally what I'll do is I'll put obstacles there and let you, let's say these water bottles, and say walk in between. Let's see if you can do it. And you see people just knocking things about. Wow. And that is your completely
but
drunk.
Even this one, you can't drive like this.
Exactly. So that person telling me that, you know, they've got this big tolerance and they can drive and do, this is what is happening on our streets when they drink. Good so Lord. These are some of the things that we do for alcohol education.
Explain to us the scientific process, right? How do people still know that this is the turn to my house, this is the junction to my house, even when they are drunk? Like, I don't get it, because cognitively, your brain is not functioning at full capacity. Exactly. It's impaired. Thank you for the language. So how do we still know that this is the route to my house?
Okay. Remember that you have memory. And then as you're growing up or your everyday life, you have a routine. You know, I have to wake up, have a shower, do this, eat, go to work. So that's become your life for maybe years, months, whatever. So these are activities that are already there at the back of your brain, your long-term memory, short-term memory. So the fact that you're drunk doesn't mean that you don't remember things. It's about the safety.
So your retentive memory is there.
It's there. So you know that I live at, oh gosh, I just want to remember a place.
Of Anchor.
Yeah, of Anchor. And I have to get on the, I don't know the name of the roads, but you know what, the main road to get there. So you pick your car, you know the route and everything, but it's about the safety to get there. So it's not where you're going. You know exactly where you're going, but how to get there. Is it safe for you to get there? That's when I should have brought a breathalyzer, but both of you are not drunk, so you'll be useless. So we breathalyze to see where you are on your alcohol level. That's where in other countries, the police will stop you when they think, what's going on with this driver? Breathalyze you and think you can't drive. You may know my home is about a mile away. Oh, no. You can't drive because what we've got, the alcohol content tells us that you crash before you get there, or you harm somebody, you will endanger somebody, that sort of thing. So my answer to your question is, the fact that you're drunk doesn't mean you don't know your home, unless it's really, really bad to the extent that I've had people where cabs have, taxis have carried them home, taxi drivers have carried them home, because all they were able to do was give them the address that I live at, and then the driver would just take them home. But remember that you're putting your life at risk, because that moment anything could have happened to you as well. So even that they were able to give the address, or they will go and give the neighbor's address, and then they will knock, and the neighbor will say, oh, they don't live here, they actually live there.
There's a new trend. In fact, a very popular one has even opened in somewhere cantonments, right? A trend of where now there's a lot of alcohol infused in every other thing that would ordinarily wouldn't have alcohol, right? So I'm talking about your cakes, your ice creams, and it's it's jumping on. It
gives the giggle. Remember I said about the giving you that stimulant, that buzz of feeling excited, feeling like somebody will say, oh, if only I'm going to do this presentation, if I can have a little drop of alcohol, it will boost my confidence and whatever, I need it. And we have lots of public speakers or actors and actresses who actually drink before they go on stage. You see them look so confident and that. They drink, and some of them drink heavily before they step on the stage. People who sing and all that, because they feel like they need that. But then that should tell you, if you need this, did you get the word I used? What word did I use?
Need this.
Need this. That means something is just not right. That means that you need to depend on it. It's not like I want it. Fine.
Dependency.
Exactly. So there's the dependency that without that I can't jump on stage to do what I have to do.
Wow.
But you should be yourself to be able to do what you have to do. But most people do that.
How about those who use it and say, okay, well, stimulants, the same thing.
The same thing.
Yeah.
So
that's the social drinkers. It's like I needed to get excited to dance my nights away, to dance my stress away, whatever. But the moment it moves from the social drinker, to the dependency, where psychologically you need it. So mentally you need it, physically you need it to function. It's interesting because we had a doctor here this morning, a medical doctor, who would have talked about the medical side of it. But maybe in future we can do that. Have a medical doctor sit there and myself. Then we talk about, sometimes I try not to go into it, even though I talk about it in my practice, about what is actually happening physically as well to the body, the skin, the liver, and all of that. Is very important that we factor all of that in.
There are questions there for you. Some I'm sure are just joining in, so probably missed the first half of the conversation. So this one says, good morning. This is a very important conversation, but the alcohol, no, we can't do without it. Please ask doctor how much alcohol is too much alcohol. And this is coming from Bash from Spintex. There are two more, but when you're done answering this, then I'll answer.
Bash, I think you missed the first bit where we did the cup and the measuring. So we are not here, or I'm not here saying don't drink at all. Today's program is really about reducing the harm reduction. So you're drinking, but you're drinking safely. So I'll go back again to my measuring cup and say, let's say, Bash, you drink beer. What we're trying to say is 2 of this a day is fine, right? 2 of this a day, this size cup. And if you want one, I'm sure my number will be there somewhere, or if you contact the studio, they'll give you my number. I've got lots of these cups, so contact me. But what I'm saying is 2 of this of beer a day, and also wine, that a day. So you need 2 to 2.3 units of alcohol a day, and that's safe. That's what they say medically to us. Yeah, and if you spirit somewhere down there or somewhere here, a day is fine. But remember that in a week you have to make sure you have 48 hours at least to give your body a break from alcohol when you don't drink. I'm not saying that, having said that, you should pile all your 14 units a week into one day, because that's also not safe. That's the binge drinking. Yeah. So we have to be careful how we drink, but just give your body that 1 or 2 days of alcohol break.
Rest. Sorry. I think you've answered Pamela from North Legon's question. Okay. She wanted to know how often one should drink alcohol.
Okay.
You even answered that. And this one is from Kukwa from Teshi. She wants to know the best ways to detox.
Oh, Kukwa, that's a good one. So the best way to detox, if it's a dependency, with that I'll say get a doctor involved. You can contact me, get a doctor involved, because it's not safe for you to do it on your own. Some people are okay. They can wake up in the morning and say, you know what, I'm going to cut down and I'm going to do this and I'm going to do that. But be careful where you are with your drinking. If you're drinking so much, let's say 3-4 bottles of beer a day, or a bottle of spirit, whiskey or brandy or vodka or whatever a day, then what you have to do is, let me tell you this. It's good that we have a table. People who have problem drinking, what they tend to do is they gulp drinks. Please, can I just use this as an example? They hold your drink like this. And when they hold your drink, they keep drinking. When you do that, you don't put it down. Always make sure that if you're detoxing, you have a table. And then also make sure you have a glass. It doesn't have to be this, a normal glass or a wine glass or whatever glass you use. So when you have a table, when you have you see the effort I made coming. People don't realize the psychological and the physical impact of doing this. It gets on your nerves and you stop, or you give yourself a break. So when you have a table, you have to lean forward, grab it, hold it, and also start learning not to gulp it down, but sip. You sip. So now we're going back to becoming a gentleman and a lady. Sip, put down, sip, put down. And once you've done 2 or 3, you think, gosh. So you sit like that, and then that gives you that interval. So move from your spirit to wine, because the alcohol content is not too much. Then you can move from, some people will say, because beer as well can have loads of calories. So if you want to lose weight, like I want to lose weight, be careful when you're drinking beer, because that can also let you put on loads of weight. But then beer, the alcohol content is quite low, so we can recommend when people are detoxing. Also, what we also recommend is make sure that you dilute your drink. So you can do it with a soft drink or water, whatever works for you, or non-alcohol wine, non-alcoholic drink. These days we have non-alcoholic beer, we have wine, we have all sorts. So some people want to see that their glass is full mentally. So in order for that to happen, so you put your wine or beer or whatever, then put a non-alcohol to make it full. Some people who drink so much will say that it doesn't taste the same. When you start, that's how it's going to be, but gradually. So detox by reducing and diluting. Or if you're looking after somebody drinking, sometimes it's even good if you don't tell them, if you're the carer. So dilute a little, bit by bit. So maybe the beer is somewhere here, and then there's a little bit of whatever you're diluting with, gradually. And intervals. Another trick for detoxing is also make sure that in the morning, because people who have problem drinking, they don't tend to eat before they drink, because they don't have that appetite to eat. So when you wake up in the morning, make sure that you eat something. Even if it's not much. What I recommend is a slice of bread. Bread has got this trick, especially if you can toast it. Don't put anything on, don't put any spread, whatever. Just have a slice of toast, dry toast, and it lines the stomach nicely. So when you drink, at some point you don't drink as much as, because it feels like your appetite is not as good as. So you drink, so make sure that you eat before you go out anywhere. You've got a party where it says, oh, but I'm going to eat there. What if you get there and the food doesn't come early, so you start drinking first? So line your stomach every day. Line your stomach before you go out to drink. And that helps a lot. So these are some of the ways. And also have a pattern. Let's say if you come to see me, I'll do something we call the drink diary. So basically a drink diary is not like a proper diary. You can keep a diary, but I give you a sheet that comprises your day. So from morning to evening. So every hour, what is going on? Or especially what did you do before? What was happening to you before? So I've just stepped out. I'm feeling a bit low. I need a drink. Or I'm at home. I need a drink. So you tell me that 8 o'clock you had a drink. 9 o'clock you had a drink. 11 o'clock you didn't have a drink. So I'd ask you, what was happening before you had a drink? How did you feel when you had somebody who said, I felt so guilty, I wish I didn't have it. So all this will be in the diary that you present. So when you come, then we will work through, every 11 o'clock, have you noticed that you drink? What goes on around 11? My manager stresses me, so I just walk out quickly and I drink. Or that's when the baby is crying or the baby is asleep or whatever. So we say, okay, that means we need to engage you around 11. So 11 o'clock, can you now start coming to see me at 11? Because if you're coming to see me, you won't drink. Or you go to the gym, or you see your friends. And also, if you have friends who drink a lot, I'm not saying isolate yourself. Start looking for other friends. Because it's difficult. I mean, if you've got this culture, how are you going to break it? You can't break the culture of the drinking. Do you get my point?
Tell you a sum total of the people around you.
It's very important.
Wow. Doc, how can we reach you, right? So if anybody's watching.
Before that, there's one here. This one says, we have been taught since childhood that kinky and some other foods contain some level of alcohol. What happens to some of us that eat too much of these foods, especially?
I'm not a specialist in KK or food or a dietitian, so please, sometimes I don't want to crucify myself by saying things. But what I'll say is, food with lots of vegetables, your protein, I don't think would affect you in terms of alcohol. So don't worry too much. You can have your the kinky, mashed kinky and all that. It's not. We're talking about proper fermented distilled alcohol. That's the purpose, is to have an effect. What we're saying is drinks that have an effect on your central nervous system, your brain chemicals, and that is what we're talking about. But our everyday food, please don't go into that, because then I'll have somebody calling me saying, doctor says I can't eat kinky anymore. Not
that's
at all.
What you're saying. Okay,
Doc,
yes, your socials and how people can reach out to you.
On TikTok, follow me on TikTok, because I put a lot of information there. Is Dr. Annie Gazy. I've made it very simple. My telephone number, if I can tell the kind producers to put it on screen, because you'll be surprised how embarrassing it is, but I don't even know my number off by heart. But please,
050
thank you
035 8435.
Repeat.
050 035 8435.
Thank you very much. You see how bossy I can be. Or you can go into my LinkedIn as well, whatever, and then just ping me a message, and then I'll respond if you have any question, or if you need my assistance in terms of therapy. And that is where hypnotherapy briefly comes in, because sometimes about the willpower, if you're struggling yourself, I use that clinical hypnotherapy, basically deep relaxation, to get you into a happy place, to motivate you to reduce your drinking and to stop if you want, or to be a social drinker. Wherever you are, that's where we work with.
Thank you so much for your time.
Thank you.
Always a pleasure having you.
Same.
You're grateful.
Thank you.
Very interesting show today.
And take your caps home and come and tell me something. That's your homework.
Go
and educate other people.
The wine, we'll talk about it later. We'll try it, Doc, and I'll come and tell you 2.1 units of wine. We'll try it and come and talk about it later. But thank you so much for joining us this Sunday. We hope to see you next weekend. Do join Jude and I, and have a good Sunday. Bye.
Welcome to the Health Quarters Ghana, where medical science meets everyday life. Join Dr. Gideon Asen and the irrepressible Clemento Suarez as they tackle health issues.
My name is Dr. Gideon Asen. I have with me here my co-host, Clemento Suarez. I knew how it felt anytime I started to feel the pain.
Whether it is hernia, breast cancer, cataracts, or infertility, the show brings together victims to share their real life stories and experts to debunk myths.
If you wear cotton supporter when they wear pampers and a benwa or bosun. So you see, instead of it being raw egg, I done it because you know.
Make a date with us every Sunday at 4 p.m. on ChannelOne TV. Don't forget to subscribe on YouTube and all social media platforms at Health Quarters Ghana.
See, the way I'm suffering here. Finally, God has listened to my prayers. Let me tell you something. This interview I come to do, if you not get me, man, are you already there? Are the vipers? Are you back? I want a nice looking lady. Nice one. Like,
get ready for all the shenanigans, the gossip, the gisting, and the jiving. The typical happenings at a Ghanaian pub, aka Sport.
And everything is sauce. Charlie, this one no sauce fishing. Stop! I see the girl she I guess now as I bring the truth, some scene here happen for the content back there, man. No, get me wrong. I'm here with these guys trying to prepare a surprise proposal party for you. And you are here chilling with this guy.
Don't miss this fun and engaging TV series, Junction 5, on Wednesday at 7:30 p.m. only on ChannelOne TV.
Habibi, my people, welcome to Dubai. My name is Sheikh Alkal bin Maktoum. Okay, so I am Caleb, right? Caleb Kuda is my name, and this is Beyond Borders on ChannelOne Television. We are in Dubai. So join me. Let us explore the allure, the beauty, and the reality of life and living it in Dubai through the eyes and the experiences of our compatriots.
Imagine 6 people, 10 people sharing a common room together.
If you're not chinampe, no, we'll complain there in the sense, you know, why do I share one rooms now? It doesn't smell pleasant. We're hunting no complaints now, baby, until they feel a new tomb.
Dubai is one of the most organized, highly resourced, and well-endowed countries you would find.
You've been here for 7 months.
Yes.
Without a job.
Yeah.
How is it like?
So hard.
Tell me about it.
Struggling, renting and feeding is so hard.
Every frame per second of their lives in Dubai tells a story, and we've got it all captured right here on Beyond Borders, only on ChannelOne Television. So don't get told, don't miss out. Catch these compelling stories of Ghanaians in Dubai only on Beyond Borders on ChannelOne.